Do I really need an employee handbook? What's the point? I'm Erin Jackson with Jackson LLP Healthcare Lawyers. At most jobs you've had in the past, you've probably been given or seen on the shelf an employee handbook. But have you ever really read it or ever really understood the purpose of it? An employee handbook aims to get everybody on the same page. This is particularly important in healthcare, where different employees have different scopes of practice and different responsibilities. And it's really important they not infringe upon one another. It's also really crucial to establish uniform anti-discrimination, anti-harassment, and especially in some states, required sexual harassment policies at this point. A proper employee handbook should address things like PTO or paid time off, sexual harassment policies, drug and alcohol abuse, the use of social media by employees, and legalized marijuana use, among many other compliance matters. One of the really important aspects of an employee handbook is the signature page. So all your employees should sign off on having read, understood, and agreed to the terms of the employee handbook. There's certain aspects of it that are really important to be drafted by attorneys because it's crucial that the employee handbook not be construed to override your employment contracts or your independent contractor contracts with these workers. It is not a substitute for an employee contract. It is merely the policies and procedures and standards of conduct that all employees are held to, regardless of who they are or what role they play. It can help insulate you against discrimination suits or retaliation suits, and it can set out things like hiring and firing practices and penalties for misconduct. To get help with establishing your employee policies and then putting them down to paper as an employee handbook, reach out to our firm and we'd be happy to assist. For tips on how to keep your healthcare practice compliant, subscribe to our YouTube channel.